You're watching CTOM TV. Knowledge is power. Nina is wondering, can radiation from mammograms cause cancer? And if so, should I still have them?
Well, I think, you have to consider the sensitivity and the specificity of the mammogram first.
Okay.
I would always say get the test, definitely, even if it's a false positive, you can disprove it with a biopsy. You're better off having a false positive than a false, than missing the disease. So
meaning if
I would much rather have her go through the process of a scare of cancer, have a lump investigated and biopsied to find out it wasn't cancer, than for her to miss it altogether. Because then, the latter would result in a very, very difficult situation, because then you'd have late stage cancer that was very hard to treat.
It's true. If you're having any of those funny symptoms, it really is better to
just check it out.
Even if you're nervous and you just don't want to know, you don't want to find out. There's so much that can be done in cancer treatment now. It's not the way it used to be, even just 10 years ago, where really all you had available to you was standard chemotherapy and radiation. There are hundreds of different types of targeted therapies and different types of immunotherapies that really are helping people live so much longer with such fewer side effects. And catching it early gives you such greater chance. So if you have any doubt at all, or any wondering at all, Nina, definitely, as Alex is suggesting, go and have the test and really push your doctor to follow up. It's much better to find out than to wonder.
Yeah. So that was the first part of the answer. The second part of the answer is yes, mammograms can increase the risk of cancer, but only in people that have genetic susceptibilities.
Okay.
So if you have a mutation, for example, in your XRCC1 gene or your ATM gene, these genes are involved in excision repair and repair processes that repair DNA that's been damaged by ionizing radiation. So when you have deficiencies in this, then you have a higher susceptibility to developing cancer from lower dose radiation sources. So in patients that have those mutations, now you can get yourself tested for that. In fact, we have a great program where we have a testing. If you don't have cancer, we can do a full genetic testing and workup, and we can find out if you do have mutations in those genes. And if you do, then obviously we'd be looking at doing alternate forms such as ultrasound or MRI, rather than risking radiation.
Right. So that's right. So you would use different types of testing to kind of keep on top of any breast cancer development. And when people find out about those inherited mutations, there's actually so much more they can do to help prevent.
Well, ironically, while these inherited mutations increase your risk of developing cancer from radiation, they also make your cancers amendable to treatment. In fact, there's a recent study that showed that when people have these mutations, although these mutations probably resulted or were in part the cause of their cancer, they had an incredibly high response rate to radiation therapy. And we have a few patients with ATM mutations, breast cancer patients, and when they develop metastatic lumps in their bones or elsewhere in their body, they get it zapped with radiation, and it evaporates it literally.
Yeah. And knowing that you have those mutations is the information that you have to have in order to convince your oncologist to prescribe those treatments for you. That's kind of the catch-22. So without that genetic testing, your oncologist doesn't know that that's something that you need.
An incredible response to RT.
Yeah. So if from a prevention perspective, having that inherited mutations test is really helpful. And then if cancer does develop, it's extra helpful in making sure that you get the right treatment.
Exactly.
Thank you for watching CTOM TV. Subscribe below and stay informed.